First of all, I'm going to give a disclaimer and say that a lot of people probably will have a different opinion than me. I am somebody, because of my Munchausen by proxy survivor history, I need a sort of laissez-faire doctor. I need a doctor who, when I come to them and I'm scared about something, I need them to actually not do a whole lot, because doing a whole lot is the way I was abused. And so I have a lot of anxiety about my health, but I also need reassurance that is really based on like very old-fashioned clinical judgment and dialogue conversation, not blood tests and CT scans. Yet, I need to believe that the doctor would order those tests if I really needed them. So I'm a little bit complicated, and I'm fully aware that the majority of the comments I'm going to get, no matter what, are people who feel that a doctor didn't test enough, didn't listen enough, didn't run the necessary tests. Anytime I tell my story, people want to tell that story, the opposite side. And it's an important side. Obviously, we don't want doctors to overlook things. We want them to listen to patients. However, I actually think that's a much more common story. It's a narrative we've heard. And we haven't heard the narrative of the other side, of people like me who were hurt by over-testing. In America, doctors are so scared of liability, being sued for missing something, because you know Americans are very trigger happy with lawsuits. They're so nervous about that if you go to a doctor and you say, I'm worried, I've been having this symptom and this symptom, more often than not, a doctor is going to feel like they have to run, almost like they have a flow chart of, I run these 5 tests or I could get in trouble. And so the doctor is running the tests, even if they, in their head, they know that it's fine, they're running the tests almost more for their protection than for the patient's benefit, in a way. Sometimes that's because they know the patient will get mad if they don't run the test. So in a way, it's for the patient, but it may not actually be beneficial to the patient. It is not actually best for the patient to have 1 million tests run in most cases, because none of us are actually perfectly normal. And when the test gets run, there will usually be 1 or 2 things that gets pinged as like not perfect. And then let's say you have like high sodium or something. That can mean something and it can mean nothing. But